Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1, Behavioral Sciences. Let's get started with question number 1. For the following case, which of the following statements is most appropriate to begin a discussion about this patient's non-adherence to her medication? A. If you're not more consistent with your medication, we may have to switch to insulin injections. B. It's very important that you take your medication regularly, even when you feel fine. C. Taking medications daily can be difficult, especially on days you feel well. D. Uncontrolled diabetes can result in many dangerous medical complications. E. You seem to have difficulty understanding the risks of untreated diabetes, so let's discuss them. The case scenario is: a 45-year-old woman comes to the office for follow-up of type 2 diabetes mellitus. Current glycated hemoglobin level is 9%. The patient was diagnosed with diabetes a few months ago and was started on metformin twice daily. When the physician asks how she is doing with her medication, she replies, "I use it most of the time, but it's easy to forget when I am feeling good." The question is, which of the following statements is most appropriate to begin a discussion about this patient's non-adherence to her medication? Your options are: A. If you're not more consistent with your medication, we may have to switch to insulin injections. B. It's very important that you take your medication regularly, even when you feel fine. C. Taking medications daily can be difficult, especially on days you feel well. D. Uncontrolled diabetes can result in many dangerous medical complications. E. You seem to have difficulty understanding the risks of untreated diabetes, so let's discuss them. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is C, which is: taking medications daily can be difficult, especially on days you feel well. This question is designed with the focus to assess your ability to demonstrate professionalism. This patient with diabetes has suboptimal control of her blood glucose levels as evidenced by her elevated glycosylated hemoglobin level. She may also have limited understanding of her disease and the potential complications of poor glycemic control, believing that she can skip medication when she feels good. Medication non-adherence is more likely to occur when detrimental effects of missed doses are not immediately apparent, as in this situation. The best initial approach to medication non-adherence is to acknowledge the difficulty of taking a medication daily. Validating this patient's experience, rather than immediately judging her behavior, is more likely to facilitate an open discussion of her understanding of the illness and the factors contributing to non-adherence. Addressing possible misunderstandings about treatment in a non-judgmental manner is crucial to promote medication adherence and strengthen the therapeutic alliance. If you choose any option other than C, you are wrong. Let's briefly discuss the other options. Choices A and E cannot be the answer because these statements are condescending and judgmental in tone. Physicians should avoid criticizing the patient's behavior or assuming a lack of knowledge. Choice B cannot be the answer because this statement gives the patient a directive without first exploring her perspective and understanding of the illness. The best initial approach is to engage the patient with a statement that validates her experience and encourages open discussion of her challenges with medication adherence. Choice D cannot be the answer because it would be inappropriate to initiate a discussion on non-adherence by warning the patient about dangerous complications. Education about the illness and the importance of adherence should be done in a supportive and non-threatening manner. Your take-home message from this question is that physicians should use a non-judgmental and patient-centered approach in discussing treatment non-adherence. Acknowledging the difficulty of taking medication regularly can strengthen the therapeutic alliance, potentially improving patient receptiveness to educational efforts. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.